Good morning, good afternoon, good evening, everyone. Welcome to our EPI-WIN webinar today on monkeypox outbreak and mass gatherings. My apologies for the slightly late start as we had some technical problems. We just wait a few minutes for everyone to be on board. And we also have live streaming on YouTube. We'll just wait 2 minutes for everyone to join. There's still people joining right now. Today, we also have, while we're waiting, I'd like to let you know that we also have interpretation into French, Spanish, and Portuguese. So those of you who are Spanish speaking and Portuguese speaking, you'll also be able to listen in. Just click in the interpretation button down there at the bottom of your screen. This webinar is being recorded. And it is also being live streamed. Right, while we're waiting, I'd like to begin. I'm Supriya Bezbara. I'm the team lead for the WHO Information Network for Epidemics, or EPI-WIN as we call it. And it's our pleasure today to talk about mass gatherings in the monkeypox epidemic. As you know, we have an unusual epidemic and it started in May, and as of 21st June, the number of cases of monkeypox has gone up to 3,040 cases from 47 member states. And one of the ways of transmission that has been seen is through social events such as parties. And it's summertime now. We have festivals coming up. We have parties coming up. So we have WHO recommendations on mass gatherings, and we have our experts here today to talk to you about what you can do about it. Let me start by introducing our speakers today. We have Meg Doherty, who's the director for the Global HIV, Hepatitis and STI programs at WHO headquarters. She'll talk to you about vulnerable populations and how they can address the issue. We have Amaya Artaskos-Glaria, who's the technical officer for mass gatherings at WHO, and she will talk to you about the WHO recommendation. Then we have also from the regional perspective, because WHO Regional Office for Europe, that region has been the most affected, we have Dr. Ihor Perez, who's the acting program area manager for country health emergency preparedness and IHR, and Sarah Tyler, who's the senior communications consultant in health emergencies, both from the WHO Regional Office for Europe. And we finally have, from the ground, the perspective, we have an eminent expert, a consultant for health protection with the UK Health Security Agency, Bayard Nozad. He's also the lead consultant for Glastonbury Festival, which I'm sure you've heard of, is a big music festival in the UK that's held every summer. We will start with Amaya. So over to you, Amaya. Please let us know about what the situation is and what the WHO recommendations are. Over to you.
Good morning and good afternoon, colleagues, and thanks so much for the opportunity. Maybe Supriya, quickly checking with you that I'm sharing and you can see my screen. I'm trying to share it in a slideshow as well, so checking that you can see that as we speak.
Yeah, we can see your slides, Amaya, but could you put it on slideshow mode, please?
Okay, checking now that you can see it also on a slide mode.
we can still see your slides. Yeah, no, this is still not on slide mode. At least I don't see it on slide. Yep, that's
Checking
perfect.
now. Is that perfect? Brilliant. Thanks so much. So continue a bit with the hiccups, but thanks again so much for inviting us to this webinar. As you mentioned, my name is Amaya Tascos, and I'm a technical officer working in the field of mass gatherings here in WHO Geneva. And together with me, well, today we have quite a lot of, an amazing panelists and huge expert group of experts, and therefore very happy to be discussing today with you on how to hold safe gatherings, especially in the context of monkeypox, the current outbreak that is ongoing. And therefore, I'll be really happy to brief you on the current advice that we are provided at global level in this case. And we have, of course, colleagues that work at regional level, and even better, colleagues working in the field. And we have the Glastonbury experience we just started 2 days ago. So looking forward to share with you all our experience. And of course, this is a very timely topic, as we know we have all the summer festivals, concerts, and many other events that they are just starting, especially in the northern hemisphere. But of course, all over the globe, there are plenty of events happening, and therefore it's really important to discuss the work that we are doing, and especially with event planners and host governments to ensure that we have safe gatherings and successful gatherings as well. And we know very well from past experiences, especially from COVID-19, that gatherings may represent a conducive environment for transmission of infectious diseases, and in this case for monkeypox as well. And usually this is because these gatherings entail a really close proximity, and usually it's for a prolonged period of time, and also a lot of frequent interactions among people, and therefore these attendees could be really in contact with, in this case, different lesions, body fluids, respiratory droplets, and contaminated materials, and therefore get infected as well. But nevertheless, and the recommendation that we have right now in WHO is that we're not recommending postponing or canceling any.
Amaya,
yes.
Sorry to interrupt you. The slides are not moving.
Yes, sorry. Yes, I will move in a second. So just giving you a bit of the background, just to say that currently we are not recommending to cancel or postpone any of the events in the areas where monkeypox cases have been identified as a default measure. But rather what we are trying to do now is use this as an opportunity for information sharing and information outreach and community engagement, to make sure that we're empowering those communities, those individuals in the communities, to prevent any further cases and make sure that there's an effective management of the current outbreak. So yes, I think that you can see. I just move now to the next slide, and just to say that briefly, and in the next couple of minutes, I'll take you through the definition. What do we mean by gatherings? Because sometimes it's not that clear. We'll explain what are the WHO recommendations, a risk-based approach, and the recommendations, and the current advice that we have both for event organizers, but also for host countries and attendees. And we'll end up sharing with you some of the resources that we have available, so then you can have a closer look at the very end. So starting with the definition, what do we mean by gatherings? Because sometimes, again, it's a bit broad of a term. So basically, gatherings are these events that are characterized by the concentration of people, and usually they are in a specific location, they have a specific purpose, and it's during a very determined period of time. And most of the times they can really vary in nature. So it could be public events, could be private events, could be planned, spontaneous, could be a one-off, and they can have different sizes as well, and duration. Some of them have really high visibility events, but many others are much smaller. So therefore there's different types. Therefore, when we're discussing again, back with the types, we can discuss about sporting events, religious events, cultural or entertainment as well. And as mentioned earlier, what we are discussing specifically today is that usually within gatherings, we see that there's a likely high density and mobility. So what we define as crowding, and therefore this can represent this environment where there's a very close, prolonged, and frequent interactions between people that can therefore be associated with this higher risk of transmission of infectious diseases. Gatherings might be also associated with widespread of adoption of some very specific risk behaviors and unsafe practices, and this can include as well unsafe sexual practices, and therefore this can play a role in the spread of the monkeypox virus. I think it's important that we always try and share this key message with people as well, is that gatherings as well, they are not only recreational events, they have also very important implications in people's life. And so, for example, religious events can be really important for the spiritual well-being of large number of individuals, and they can also play a really, really important role in promoting healthy behaviors and in economic terms as well, so providing employment for a great number of people and leaving a positive legacy behind as well if this is well done. And therefore, this is all very important when discussing with event organizers and countries to make sure they consider that all this is taken into account and all the risks, and especially the public health associated risks, are adequately addressed, and make sure that there's mitigation measures in place to make sure that the event is a safe event and a successful one as well. In WHO, the key methodology that we use for any mass gathering events or for any event as well is to follow a risk-based approach, and basically the decisions that in this case event organizers and the host countries, they need to take, deciding if they want to carry on and hold the event, modifying, postponing or canceling any gatherings of any size and type, should really rely on this risk-based approach, and this should be really tailored to the specific characteristics of the event, and should be repeated. It's a cyclical process, so every couple of weeks this should be repeated, taking into account the epi situation and the context of the country. So therefore it's a dynamic process where we are evaluating all the key aspects related to the event. So WHO again recommends that this is done with relevant authorities and the event organizers, and it should be really a process where everybody's sitting around a round table, and it's an inclusive process, a transparent and open to all relevant stakeholders. As you can see here, there's three key steps in the WHO risk-based approach. The base one is risk evaluation, and this is basically the identification and quantification of the baseline risks that we have related to the event. So where we have a look at the characteristics of the events as well as in the context that the event is going to take place. The second one is risk mitigation. So we need to make sure that we apply a package of precautionary measures to make sure that we are decreasing the baseline risks and all the risks that they are related to this event. And the last one, and I put it in red because it's a really key one, is risk communication, where we need to really explain and proactively explain and disseminate information on the measures that we have put in place or we are planning to put in place, explain the rationale behind it, and how all the decisions that they've been taking. So therefore, we are quite lucky today as well, because some of our colleagues in the Euro office, they work in risk communication, community engagement, and therefore we'll get some intel and some further details on this as well. But mainly, I would like to mention and emphasize, as well as I was referring to at the beginning, is that in the context of the current monkeypox outbreak, monkeypox associated risks should always be considered and factored in when planning for a mass gathering event, and therefore should be really taken into account when doing this risk-based approach. But currently postponing or canceling any gatherings in areas where monkeypox cases have been detected is not required as a default measure. Now I'm going to move, and we're going to tell you a bit of all the recommendations that we have in place, and maybe quickly can mention as well that this is a draft document that we are putting together here at WHO HQ, and we're planning to release this, if not this afternoon, probably most likely will be tomorrow. So currently it's on a draft, but we really wanted to share with you these recommendations that we're putting in place to decrease the monkeypox transmission, at least during mass gatherings or any sort of gatherings events. The key ones that we are recommending for health authorities is basically to start identifying the key events that they are in place in the jurisdiction or in the area, and they could be most likely associated with the risk of monkeypox transmission. So this is usually based on the prevailing modes of transmission and the likely profile of the attendees. We also recommended to ensure that monkeypox is included among the diseases that regularly are reported through routine surveillance. And in this aspect, WHO has published recently a key guidance on surveillance and case investigation, and is one of the resources that we will be sharing with you after the webinar. It is important as well for health authorities to make provision and ensure that there's a prompt isolation and adequate clinical management for any of the cases that they are identified. And in this regard as well, WHO has some guidance that will be included in the resources. And we need to make sure as well, and really important, that we are keeping, and in this case, event organizers and health authorities are keeping the general population informed on the evolution of this outbreak, and monitor and address any rumors and disinformation as well about monkeypox. We have great experiences of disinformation, rumors, and misinformation on COVID-19, and therefore all those lessons learned that we have from COVID-19, now it's time to implement it as well and make sure that we are addressing this. In terms of event organizers, it's really key as well that they establish a liaison with relevant health authorities, and they are aware as well of the epidemiology and all the latest news that they are regarding to monkeypox in the area where they are hosting events. And most importantly, I think at the beginning I was mentioning as well, is that gatherings should be really used as opportunities for information outreach and for risk communication and community engagement activities, targeted individuals' behaviors associated with site gatherings and maybe unplanned congregations and more unstructured socializations, or maybe small parties, parties in bars and so on, where all this transmission can occur as well, and therefore this can also be targeted as well. Health authorities and event organizers therefore should facilitate all the adoption of these public health and social measures that we are discussing, with the aim to make sure that the infection and prevention control policies measures are in place, and are in there also to decrease the risk of transmission of monkeypox in conjunction with events. And make sure as well that all the staff responsible for dealing with people who are ill, especially if they fall ill during the event, are provided with the information in what they need to do, how to identify them, how to manage those specific cases, and also they are aware of the signs and symptoms consistent with monkeypox. And if they need to use any specific personal protective equipment, they are also provided with that as well. And I'm going to move with almost the final one, that is the specific advice that we have in place for people that are attending any types of gatherings, as well as people organizing maybe smaller events themselves as well. So basically the key one that we are recommending is that people that has already signs and symptoms consistent with monkeypox should really not refrain from close contact with any other individual. And of course, if they're feeling unwell, it will be much better. We recommend that they don't attend any mass gathering events, but rather should follow any advice and the advice from relevant health authorities, and visit the healthcare practitioner to make sure that if possible they can be tested and they can isolate themselves. In terms of the close contacts, and including sexual contact with someone who has signs or symptoms consistent with monkeypox, this sexual contact should be avoided. And anyone who is who feels that they might have been exposed to monkeypox should also exercise additional care and refrain from that as well. But information specifically designed for these communities, for example, communities of gay, bisexual, and men who has sex with men, is now really available as well on the WHO website. And I think that my colleague Meg probably will give us a bit of details on this later. So thanks in advance for that. Also, information specifically designed for communities is already in place within WHO, and maybe it will be important also to mention that attendees should always be reminded to apply any individual responsibility and be sort of the manager of the own risk as well. This was something that we were promoting previously with COVID-19, and it's certainly something that we are promoting now as well. And just to say as well that finally WHO, as you know, they are monitoring all the current monkeypox and the outbreak and the situation that is fastly evolving as well. And therefore, if there's any new data, new evidence, and we need to update and change our advice, we'll do so. But for the moment, we'll be hopefully again sharing with you all this information by the end of the day, if not tomorrow. I will be sharing with you, let me quickly go there. I will be sharing with you some of the documents that they have already in place, and therefore later when people, if they wish to read about it, they'll have the opportunity as well. But just to say as well that if event organizers and host countries, they need any assistance from WHO, we provide assistance when planning mass gatherings before, during, and after the event, so they can feel free to get in touch with us. But other than that, I'll be happy to answer any of the questions that my colleagues or people attending the webinar may have. So I think I'm going to stop here, Supriya, and again, thanks, Emilio, for the opportunity. I'm happy to take any questions. Over to you.
Amaya, for that presentation, which gives guidance to different sections to the public, and as well as to health authorities on what to do and what not to do. We will have, I think, questions at the end of the session, and I also would request everyone to please, to make it easier for us, put your questions on the Q&A section so that we can see it and try and respond to it. And at the end of the session, I hope by then all your questions will be answered. Now, though, we'd like to go on to our next speaker, who's very well known in the HIV field, Dr. Meg Doherty, Director of Global HIV, Hepatitis, and other diseases with WHO HQ. Over to you, Meg.
Thank you very much. And I just want to check, are you able to see the slides in full screen mode?
Yes, we can.
Perfect. And thank you. I think the overview by Amaya was perfect for this, because I was asked to touch upon working with vulnerable communities and communities in general. And essentially, I'm speaking on behalf of a really strong team of people from my department of HIV, hepatitis, and STIs, as well as the risk communication group out of the WHE, who have been, since the beginning in May, working together to address some of these messaging for communities. So you heard already that we're over 3,000 cases in this outbreak, but I think what's important to note is that we're also including in this measuring what's been happening in the African region as well. So that our response in working with communities has to deal with not only mass gatherings in the European region, the region of the Americas, but also we have to be including in all of our conversations about working communities in Africa who have been living with monkeypox for quite a long time. And what we'll know right now from the data that we're getting from WHO is that, and you've probably heard this out of the mainstream media as well, is that men have been affected more than women in this outbreak since May, and the transmission mode has been noted as through close sexual contact among men who have sex with men, or gay or bisexually oriented men. And certainly there have been some cases in women, but at a much lower level. And the modes of transmission, as right now, we are not calling this a sexually transmitted infection, but we need to look at that and are open to understanding what that might be in the future. But in sexual contact, you have face-to-face contact, mouth-to-mouth contact, skin-to-skin, and mouth-to-skin. And all of these exposures happen also in our daily lives. So this is what makes it so difficult to have these conversations. And we have to get used to talking a bit about sex and a bit about some of these exposures that might happen at large parties and bars and gatherings, because we want people in the communities at greatest potential risk to really be aware, self-aware, and also protecting themselves and protecting onward spread to either people in their household or other partners. So what WHO has done is worked on risk communication and community engagement. We have held a couple of meetings and consultations with men, LGBTQIA, men and women, and have had input into what would be the best approach, and have developed some targeted and co-developed communication. First of all, to engage key influencers in in the social media, whether it's on channels where men who have sex with men might be seeking partners, Grindr, Scruff, and you might hear this from our other colleagues who will get on today, but also to work directly with Interpride, IGLA. These are the groups that are overarching the Pride festivals to organize and ensure that we can help spread the right information, and also put guidance for gay, bisexual, and men who have sex with men information clearly and visibly on the WHO website, along with general Q&A. So early on in May, we put out this WHO advice for men who have sex with men, which will be updated, I think, as of next week. But really talks about the worry of, we've learned a lot since the HIV, what happened in 1990s and 80s, where men who had sex with men, gay people, were stigmatized. And we absolutely don't want that to happen. And clearly, we know that stigmatizing never helps, and never helps in a disease outbreak, because anybody can get the monkeypox regardless of their sexuality. So it was important to say this is not a gay disease. However, we want people to be aware of what the risks are and to avoid some of those skin-to-skin, face-to-face interactions, including sexual contact, especially if somebody who has symptoms. And our guidance has been, if one has symptoms, go to a healthcare provider, stay at home, and avoid those close, intimate contacts. We have had several opportunities to have some of our staff answer questions, have some videos, and really try to have that conversation where communities can ask questions and be very open and forthright. So I invite you to come to our websites to talk about this. In terms of working with Pride, we've had several interactions, and we have done a video with some of the Pride organizers and festival organizers. This was done several weeks ago, and we're hoping that this information has disseminated into those festivals. But I think what's important is we want people to be able to celebrate, be outdoors, but be outdoors and be safe. And when there's indoor settings or sex-based settings, that there is a real understanding of what the personal risks are and the risks to others in the community. One thing that we've heard is that this monkeypox is presenting in a very subtle way, and sometimes is presenting clinically in what might look like a sexually transmitted infection. And so therefore, having good visuals and pictures of what to look for has been critically important for community members. And that is something that we're helping to also put out, as well as to share in clinical guidance, as well as with healthcare workers and people who identify as men who have sex with men, and also those who are organizing parties. Now, the other thing that we have said also is that festivals, et cetera, should have healthcare workers there ready to answer questions, ready to help people who need any kind of support to get the support, the testing, and if in a setting where they're looking to, they're setting up vaccination to help them get what they need. So some of the messages to communities are: stay calm, learn more about your community, avoid sexual contact if you feel you may be infected, and if not, seek out a confirmatory test, isolate at home, and talk to a healthcare worker, and then also provide emotional and practical support to family members, friends who may be asked to self-isolate, and contribute to combating misinformation by sharing only reliable information and non-stigmatizing information. I think this is critical because we've seen when we've done some social listening on media that certainly there's a lot of misinformation out. So go to the WHO website, get the right information, and in summary, our goal right now with communities is to stop the outbreak and to stop onward transmission. So we need to raise awareness, detect cases early, protect people at risk, ensure there's effective communication in festivals, and I think we're going to hear more about this in a moment, and use the appropriate risk-based strategies, which you heard earlier from Amaya, in terms of how to ensure that safe gatherings can occur. People can have safe, fun gatherings, but also make sure that we're not putting others at risk at the same time. and to ensure that there's global coordination around this, and that's why we're here today. So with that, I'll stop, and I look forward to taking some more questions as we move forward. Thanks. Back to you.
Thank
Supriya.
you. Oh, sorry, I didn't realize I was. Can you see me now? Sorry,
Yes.
I apologize for that. Thank you very much, Meg, for that very important presentation, and with some very key messages that there should be no stigma, because stigmatizing does not help anyone, and really this could affect everyone. We will have questions at the end, and there are quite a few for you, I can see that. But for now, we will go on to our next speaker, because this has the majority of the cases have been in Europe, and our colleagues from the Regional Office of Europe have also developed recommendations and have been active. So over to Ihor and Sarah to let us know what Euro is doing and what should be done. Over to you.
Thank you, Supriya. Good afternoon, good morning, colleagues. I hope you can see my screen and presentation in full mode. Greetings from European region, WHO Euro region. Today, me and my colleague Sarah Taylor will share with you some practical steps that we have already taken in the region based on the situation that is evolving. And we'll share with you some approaches that we start implementing. So starting from the early beginning of the cases identified in the WHO European region, which the cases that of monkeypox in the region, which is not endemic for such a disease, we jointly with our colleagues from the ECDC developed interim guidance for the event organizers, public health authorities, as well as the participants of these events, in order to provide a quick and practical guidance to make sure that we have all necessary information available to support the events and planning. Understanding that, and based on our data, that predominantly these cases that were identified in the European regions are among men who have sex with men, but not necessarily only, and that are transmitted through the close contacts. These joint recommendations were developed and shared on June 14th, and now are available for you as well. Many of these recommendations already reflected also and guidance reflected in close collaboration with our colleagues from the headquarters that Amaya already mentioned. All of these ideas and concepts, as Mag Dougherty mentioned, are not necessarily new, but are adopted now to the context of the monkeypox, and with the whole aim of prepare the communities and prepare the health authorities to deal with the situation, but not necessarily take a very not productive way of canceling the event or putting some restrictions that not necessarily contribute to the better awareness or risk mitigations. In order to provide full support to the member states and the organizers and the NGOs, for example, that put together the events, we at the WHO Euro region developed and jointly with ECDC developed a kit of a toolkit of different tools that we already developed and adopted for the monkeypox response. And with our primary audience that, again, as I mentioned, and Amaya mentioned, the event organizers, local health authorities, and as well as the participants. I would like to underline again that it's important to, when it comes to the mass gathering events and to big events, it's important to have these coordinated approach between the organizers, hosting authorities, and hosting communities before, during, and after the event. And as was mentioned, the risk assessment tool, generic risk assessment tool that is being now updated for the monkeypox will be also available for the health authorities. And WHO is happy to provide additional guidance to different authorities. And today you will hear from our colleagues from the UK about one event that they are planning to do. So these risk assessment tools can be practically used before, during, and after the event. Among other tools that we already in the WHO Euro put together into the toolkit. These are 6 following pillars of to be helpful for the event organizers, managers, and hosting communities. These are, as I mentioned, risk assessment tools, the evidence-based surveillance approaches developed by the WHO Euro and ECDC together. Based on our lessons learned from COVID, for example, the new approach to the contact tracing is also being adjusted and will be shared with the countries and will be practiced. The important step, important element of preparedness and response is early warning system in place, which also been updated and the guidance is developed. As Mac mentioned, the risk communication and community engagement has a humongous impact on preparedness and response and prevention, of course, of the spread of the disease. And that's why Sarah will go into more details on the risk communication, community engagement. But this is also an important and integral part of the tool set that we will be using, promoting, and adopting for the country's needs. Infection prevention and control, and as well as clinical management, is the information is and approaches are evolving. The more we know about the spread of the disease, the nature and the epidemic of the processes, and in addition to all, of course, all of these tools will be available to the member states through the online trainings and online sharing of the experiences. And last but not the least, we are already prepared. Again, not because of these new developments, but because of the recent experiences through COVID. We are well prepared through the tools to do the interaction reviews in order to adjust our course of the response, as well as the after-action review, to pull together the lessons learned for any other public health emergencies that may potentially happen in at the global scale or at the regional, sub-regional scale. Here, I would like to hand over to Sarah to continue with the risk communication, community engagement work that's been done already in WHO Euro region. Sarah, over to you.
Thank you very much, Ihor. And thank you, colleagues. I'm happy to present today some of the work we're doing around RCCE, which is at the core of the monkeypox response. And it is a key health intervention that we've used in past emergencies as well. So the complexities of this outbreak call for a response that integrate risk communication with community engagement interventions to engage diverse populations based on their risk exposure. We've produced an interim advice with our partners ECDC, which looks at ensuring timely and consistent health information advice to broader populations by using more directed channels to high-risk groups or two-way communications, and working really closely with relevant civil society organizations to leverage the trust they have to ensure that at-risk groups are empowered in prevention behavior. Next slide, Ihor, please. Thank you. The 10 risk communication tips that we are using for this outbreak jointly with ECDC, I have a list here, and after this webinar, we'll be very happy to share with you the presentation. So just to quickly go through this, we are working to identify target groups relevant to the monkeypox outbreak. We're tailoring risk communication through channels that target groups. We're explaining the science simply to foster trust and acceptance. We're acknowledging uncertainty by labeling public health advice as preliminary. We are recognizing people's fatigue for restrictions as a barrier to their compliance with health advice. And we're providing public health advice specific to the monkeypox outbreak. Thank you, Ihor. We're working very closely with civil society engagement. For example, we are working now with 50 CSOs and at-risk groups, and we're convening with them to ensure our messaging is timely, consistent, and relevant. We are forming informal working groups established with a few CSOs on social listening and collaboration. We're co-designing, testing, and deploying a toolkit for event organizers, which I will share with you in a couple of minutes. We are amplifying and providing feedback of health information and advice. We're outreaching to at-risk population groups and minimize stigmatization. And of course, the participation of CSOs at WHO press conference and Facebook Lives are really reinforcing the messaging and pushing out our health messaging to communities that perhaps it's harder for us to reach. As Meg said, we want people to enjoy the festival season safely and funnily. I'm not sure if funly is a verb, but enjoy it safely and funnily. And we know that over the summer, there's going to be over 800 festivals in the European region that will bring together many hundreds of thousands of people from different countries. Most attendees or guests are highly mobile and sexually active, and a number of them will have intimate skin-to-skin contact at or around these events. Some may also have multiple sexual contacts, including with new or anonymous partners. Without action, we risk seeing a surge of monkeypox cases in Europe this summer. As Meg also said, that monkeypox is not a reason to cancel events, but it is an opportunity to leverage them and to drive our engagement with communities, event organizers, and also dating apps so that we can provide clear information to raise awareness about monkeypox infection and strengthen individual and community protection. As Ihor mentioned from past events, we have learned that mass gatherings do not amplify transmission by themselves, but it's the behavior during events that matters. Thank you, Ihor. As mentioned, we are just about to launch a communication toolkit for event organizers. We hope to have this out on Monday, and many, many thanks to ECDC and our CSO partners and health activists who are helping us create this toolkit. Basically, it's messaging before, during, and after events that event organizers can use, which really we hope will promote safe practices so people can keep themselves and their community safe. So the toolkit will look at various angles, but it will look at the role event organizers have in protecting people from monkeypox, the step event organizers can take, for example, messages they can share with participants before, during, after the event. There'll be question and answers on symptoms, transmission, and protective measures. There's messages that event organizers can share with their guests before, during, and after an event again. There'll be easy to use and engaging multimedia tools that can be distributed, and also suggestions of the community actors you can engage with. Obviously, there's also going to be resources that you can consult, further resources you consult. Thank you. Just a very quick example of, just to mention that we're developing all this with civil society organizations, event organizers, ECDC, UK Health Security Agency, and technical units within WHO. And we're, thanks very much to the CSO colleagues who've been working with us on this too. Thank you, Eva. The next steps will be to produce these products based on our CCE findings during and post events and festivals. We'll be testing messages and materials with key target groups. We'll continue to strengthen our partnerships with CSOs and health partners through regular meetings and updates. We'll be broadening partnerships to universities for student outreach, and we'll be producing best practice case studies so we can learn from best practices from these events and gatherings. Thank you. Thank you very much.
Thank you very much. Thank you very much, Ihor and Sarah, and a lot of risk communication work going on there. We now have a voice from the ground. I'd like to invite Bayat Nozat, who's the lead consultant, who's with UK Health Security Agency, and is now leading on Glastonbury preparations for the Glastonbury Music Festival. So I'd like to invite him to let us know what they are doing on the ground to make the festival safer during the monkeypox outbreak. Over to you.
Thank you, and good morning or good afternoon or good evening to everyone on the call. Thank you very much for the invitation. Yes, I'm the consultant lead from UK Health Security Agency for supporting Glastonbury event, which is ongoing right now. So I will start with just giving you an overview of the festival and then what sort of planning we've put in place with partner agencies such as the festival organizers, the NHS and local authorities and so on. It's really good that my sort of presentation came to the end after Amaya and Meg and Ihor, because it just showcases the practical, what they talked about were mostly like, you know, the recommendations, the planning and all that, but we've done that all in practice. So hopefully it makes sense to people now as we go, how we've put these recommendations in practice. We had to make things, you know, as part of all health protection approach, risk assessment and risk communication and mitigation, before all these guidance and recommendations were developed. So we were, just to, you know, clarified, like we were ahead of these from, you know, festival planning perspective. So Glastonbury is one of the largest festivals in the world, as far as I understand. It's the largest in the UK, definitely, largest residential probably in the world and Europe as well. In 2020 and 2021, there were cancellations, unfortunately, due to COVID pandemic. So it is much, you know, people are waiting for this festival to go ahead. It is in Glastonbury, from the name. So, you know, it's a town in southwest England. Is a very much rural area, as you can see from the picture on the left. The site is surrounded by around 8 miles of fencing, which is about 800 acres. So you can imagine how big it is. We understand there are over 210 people attending this festival, including more than 70,000 staff, mainly young people, but you know, people come, you know, from all over the world, coming from all over Europe and UK, families with children, older people from all walks of life. It is a truly, you know, representing festival for all arts and music and all tastes. This year there's collaboration with Notting Hill Carnival as well, which is another carnival in London, but they, you know, there's collaboration as well with the Glastonbury Festival. So that's just a quick overview, but just to give you an idea about the planning for this festival. For example, the planning starts usually 6-7 months in advance. The first drafts of the medical and welfare planning were submitted back in December 2021, but we have to be very flexible in terms of what sort of threats and from health, you know, emerging infections and all that emerges, and we have to be flexible and adapting all this. So it's part of all health protection approach. As in Amaya's presentation, you do risk evaluation, risk mitigation, and risk communication. So whether it's monkeypox, it's COVID, it's, you know, whatever other pathogens circulating, we'll have to be flexible and work with partner agencies and the festival organizers to respond to these and put mitigations in place. So we do have a health information cell, for example. This is where we share all the intelligence and information about health-related issues. Could be, you know, pressures on hospitals, could be surveillance data on other circulating pathogens and so on. We did agree clear referral pathways, but it's not just for monkeypox, but we had to develop something specific for monkeypox as well. But, you know, there are very good relationships between the festival medical services and the local NHS system, because local health system, because we need to minimize the pressure on the local healthcare system. So there's really good cooperation with the ambulance service, with the local health system, and the festival medical services. But we had to develop something specific for monkeypox, and that was in very short space of time. And I will come on to this. Obviously, this will come with the necessary precautions, you know, the PPE, who's, what sort of PPE you need, who's going to do the clinical assessment, the sampling, the transfer of cases, and all that. So a big shout here for the festival medical services who are, being very flexible, very adaptive in terms of arranging all these and helping us with the plans and the referral pathways. Obviously, you need to test these plans. So all these plans on paper look great, but you need to test them, exercise them. So we had 2 weeks before the festival, we had a health briefing or gathering to talk about our plans and look at scenarios, who does what, and agreeing all the roles and responsibilities and clarifying these. Obviously, as part of your pre-event planning, you do your awareness raising, and monkeypox could be among wider other issues, like we had hot weather, and as that's where I come to the all health protection approach hazard. So you identify all the health risks and engaging with these communities who could be at risk as well. So nationally, there are toolkits similar to what I think Sarah and Ihor described and presented about the comms messages and all that. And we do have all these as well. So I will share in a couple of slides what we've done in terms of the proactive comms for monkeypox as well. So nationally, that's something we probably event organizers in the future could consider: pre-exposure vaccination. There's a national program ongoing, being developed in terms of pre-exposure vaccination for those groups. During the event, which is ongoing right now, be ready, regular communications with your partner agencies, local authority, NHS, ambulance, festival organizers, festival medical services, and so on. This is really key that you keep all the time sort of sharing information and intelligence. Post-event, as you know, the incubation period for monkeypox is up to 3 weeks. So if there is any exposure during any festival or any mass gathering event, the cases may not come to light straight away. So you'll have to have plans for the next 3 weeks to make sure you have the surveillance system in place to pick these cases up. So this is just to show you the partner agencies, the festival organizers, the festival medical services, Somerset County Council, Public Health, NHS England, instrumental in this, and the ambulance services. This is part of the media. As you see, it's got some national coverage as well, how to enjoy the festival safely, whether it's COVID, it's hot weather, it's monkeypox, and so on. We just want really people to enjoy the festival. And as Amaya said, there is no plans to cancel or postpone mass gatherings and festivals. It's just about having these mitigations and plans in place to ensure people enjoy the festival safely. This is the pathway just to show you, how we agreed these through NHS England colleagues and the ambulance and the local hospitals. So it shows clearly who does what, especially in hours and also out of hours, because the festival is 24/7. So you'll have to have arrangements in place also for on-call and out of hours and weekend and so on. And for the surveillance, I've just taken a couple of screenshots from our surveillance system or case management system, which shows that we've put in place a situation named Glastonbury Festival June 22, and then we have a context associated with it. So even after the festival, when the festival goers go back to their wherever they come from, if we become aware of cases linked to the festival, we still can trace them and look at them. And so we know how many cases were linked to the festival. In summary, I think the key point here is excellent collaborative multi-agency partnership. You have to have good relationship with your local health systems, with local authorities, with the ambulance service, with the festival organizers, the festival medical services to get things done. So partnership is key. Plan in advance. As I said, we plan 6 months in advance, 6-7 months we have the plans together, but we have to be flexible, and there is goodwill among partners and agencies to be be flexible and adapting to new threats and new emerging pathogens. Again, key important to understand who does what during the discussions and the planning for the pathways, so in and out of hours, and monitor the situation after the event, because the incubation period gives you 2 to 3 weeks incubating time for you to pick up these cases if exposure took place during any mass gathering event. I was told it's 7 minutes I have, so I should stop here. And I hope that was useful, just to showcase how we put these recommendations into planning. And as I said, these were developed as part of all health protection hazard approach before any of these were developed. And I'm pleased to say that our planning is in line with what the WHO recommends and colleagues just presented. So thank you, and happy to answer any questions.
Thank you very much, Fayad. Great to know that our recommendations are in line with what's happening on the ground as well. And thank you for sharing, the 2 Ps, very important: planning and partnership and coordination. Catherine Smallwood from Euro has made a very important point here, that her message, I'm just trying to get, that we need systems to inform festival organizers of possible cases after the event has ended. Festival organizers like Darklands did an amazing job at informing the participants in a timely and straightforward way back in May, and that makes a difference also. We are actually over time, and we started a bit late as well, but we will have a few questions. There have been lots of questions, so I just also want to say that today's webinar focused on mass gatherings. So our experts who are here are essentially experts on mass gatherings, on working with vulnerable people, and on risk communication. And if there are questions beyond this, we will do our best to respond, get back to the experts in this area, and respond to you as soon as we can. So there's one question: should people be afraid of monkeypox in non-endemic areas in countries? And I think I might ask Meg to respond to this, but monkeypox is still, for the general public, is still considered of low risk, but I think everyone should be careful. Over to Meg. Would you like to answer that?
No, I think you've already sort of summed it up. What we're seeing right now is that it is in this current outbreak in North America, and also in the Northern Hemisphere, and also in Latin America. What we're seeing is primarily focused in a population of men who identify as men who have sex with men. Now, there has been some other spread, but we're not seeing multiple spreads from those, what we call secondary transmissions. We're not seeing many of those at this time. But what we have to say is every day, epidemiologists and people who are working like at Glastonbury, we have to be alert to the fact that this is spread from person to person, face-to-face contact, skin to skin, mouth to skin. And so that the fact that it's sort of taken off in a social and or sexual network doesn't mean it can't take off in another network as well. So I would say people don't have to be afraid, but people have to be informed, aware of their own risks. And if somebody is worried or concerned, that they speak to their healthcare provider, and that you also, if you are diagnosed as being somebody with monkeypox, to do that isolation, protect those others in your social networks and sexual networks. Thanks.
Thanks, Meg. There's another question for you. What would you describe as unsafe sexual practices related to monkeypox transmission?
Well, I think what we don't know necessarily at this point in time is whether this is a true quote unquote sexually transmitted infection. But there are many infections that we consider sexually transmitted infections that happen because during sexual contact of any kind, skin to skin and body parts are close. And so I would say those kinds, what is unsafe in this category, and there is nothing that is safe, safer, or unsafe. I think we in the HIV field don't really speak about that, but what we talk about is how to protect oneself and protect others. And if somebody has open lesions that could be monkeypox, having skin-to-skin contact at that time, or somebody has oral lesions and having mouth-to-skin or mouth-to-mouth contact at that time would not be a good practice, and it could be something that should be avoided at this time. So I think that's the most I can say. I think it's quite clear that we have said condoms may be able to help protect against other sexually transmitted infections. It can protect against pregnancy, but it's not necessarily going to be, as far as we know right now, protective against monkeypox. And there is many more studies that need to be done to know whether or not monkeypox is found in various body fluids. I know that was a big question that came up. And just to say, that's a huge area of research that is underway right now. So nothing we can answer definitively. And we'll say more when we learn more. Thanks.
Thanks, Meg. Another quick question. There's a question that asks whether you can get monkeypox, for instance, through sweat.
If that's for me, I would say again, all these questions about, is it found in sweat? Is it found in saliva? Is it found, etc. Area of transmission dynamics, that's a huge question of research. One thing I would say is what we do know is open lesions, open blisters, blisters that are developing are infectious. So skin to skin, so not necessarily sweat itself, but lesions, and those remain infectious until the time when the scabs crust over and fall off. So I think the issue is people have to be aware and looking on their skin if they think they might have been exposed, and then people who are diagnosed or told that they have monkeypox, they should avoid crowds, they should avoid going to these festivals, and they should tell their contacts so their contacts can also avoid. Because the goal here, as we heard from Glastonbury, is it requires not only organizers to have some responsibility of putting in measures to protect people, people also have to protect themselves through awareness and protect others, that if they do have symptoms and if they do not feel well, that they don't attend these large festivals at this time. Thanks.
Thanks very much, Meg. Another question, I know we're running out, but there's so many interesting questions. One is for the risk communication people. How do you raise awareness among the audience who are considered as high risk, but in a country without any case yet? Over to Sarah, perhaps?
Yeah, I can, and then maybe Ihor if he wants to come in, or Meg. I think it's about being ready, and this is why the toolkit, I think, is going to be so important. And why we're going to be looking at adapting the toolkit as we go forward. I'm not sure if Meg wants to come in on that, or Ihor.
Well, just to add that when we have to adjust to a new reality and remember that when we talk about the risk communication, we're not only necessarily talking to our target or believe that our target audience are these that are risk of the infection only, but the risk communication, we also talk to the decision makers, public health authorities, organizers, and especially before and during and after event. And this is what Katie Smallwood pointed out. It's important that the organizers and the public health authorities understand that the public health threats are not ending with the ending of an event. Because the event itself is just a congregation, but the consequences of the interaction continues during and after the event for quite some time. Our lessons learned from, for example, Euro 2020 last year in the European, WHO European region shows that the contact tracing and data management should be also organized, and this is also part of the risk communication in terms of the making aware the decision makers about the importance of these type of actions from their side. Over.
Thanks, Ihor. Thanks for that. A quick question now for Amaya. Two questions. One is, will there be lockdowns or travel restrictions or event cancellations like there were with COVID? And the other one is, will big events be legally forbidden? What are the WHO recommendations around this?
Thanks very much, and I think very much in line with COVID, and of course after these two almost 3 years of COVID restrictions now, especially these I mean, a lot of people they're out and they're ready to enjoy. But again, when we were discussing about this postponement or this decision making to WHO, and in terms of cancellation, if there's gonna be any cancellations, what is the WHO recommendation is for events organizers to really apply this risk-based approach with the key 3 steps and taking into account not only monkeypox in this case, but other infectious diseases and other hazards as well when planning for an event, and therefore really using that tool to make up the decision and really if needed, and if they are planning to go ahead, put all this package of precautionary measures. So mentioning always that there's not only one measure that is going to work, but rather a big package of precautionary measures. So in terms of WHO's mandate, for us, our mandate is not really to legally say if we can, they can go ahead or not, but rather we provide this risk assessment and all the technical guidelines for these event organizers, host countries, sit down together around this round table and have this discussion in order to come up with the solution. But certainly currently again, the position that we have is that due to monkeypox, these gatherings, they should not be cancelled or postponed currently with information that we have so far. So thanks a lot, and I hope I answered your question, Supriya.
Thank you very much. We're now almost a quarter of an hour over our original time, and there's still lots of questions. Many of your questions are, some of your questions are regarding whether monkeypox is a public health emergency of international concern. I've put the links on the chat. The committee, IHR committee met yesterday, and there will be a statement today, I believe, later on officially from our media team. So, well, do check our website and you will get the statements on that. There are many other questions on transmission, on other issues. Some of you will have the answers. We have a Q&A section on the Monkeypox website, which will answer many of your questions. Also on what the situation is, how many countries are affected. That's also in our monkeypox disease outbreak news, which is also on our website. And I've also put those links on our chat. We will also have more webinars on monkeypox in the coming weeks, and we'll try and get different experts who will be able to address different areas of your concern. We will also try and get back to you with as many responses as possible. But for today, I would now like to bring this webinar to a close with a huge thank you to start with to all the participants. Thank you for your questions. Thank you for your interest. And we hope we will be able to address most of your concerns. A huge thank you also to all our panelists, you know, who are all extremely busy, but have spared one whole hour to this, and much more actually, because it takes time with all the presentations and all of that. Thank you to Meg, to Amaya, to Sarah, to Ihor, and also to Bayat, who's agreed in spite of being in the middle of organizing the Glastonbury Festival, to come and speak to us about what it's like on the ground. And there are also many other colleagues who've been in the background and have been working on this. So thanks very much to all of them. And last but not least at all, to our interpreters. We have 6 interpreters today from English to French and to Spanish and to Portuguese. I hope that's been helpful to all of you, and a big thanks to all of them. I'd also like to thank my colleague and co-host in this webinar, Jiangfang Liu, who's also responsible for putting all the information up on the web very quickly. And also to the risk communication team here at headquarters, especially Mindy and Lelia, who are not here today because, but I hope they will get to listen to some of the webinars, and their role in risk communication has been really helpful. Thank you very much to all of you, and I hope to see you next time.
Thank you. Take care.
Bye.
Thank you. Thank you all.
Thank you.